not here because of our Midwest District Council, which I hope you did get a chance to watch, and we had a great time with that. But tonight, we're back with two guests about a very important subject that we really need to talk about. First of all, I want to welcome our guest, my dear friend, Mr. Rick Stevens, who is president of Christian Hospital Northeast, and he's doing a fantastic job of bringing health care to this North County region. Also, we're glad to have Michael Whittier with us, who has a lot of good information to share with us tonight. You know, I know this has been normally our Wednesday night Bible class. And over the past several weeks, we've been talking about different subjects because we feel they're so important to each one of you, to the community at large. And tonight we have something I think is very, very important that we need to discuss. I want everybody to remember August the 4th. August the 4th is coming soon, and that'll be a time to vote. With all the changes going on in our nation, we need to go to the ballot box and to cast our vote. So tonight we're going to talk about a subject that you have a chance to vote on August the 4th, called expanded Medicaid. And I think you really want to pay attention to this because I guarantee you, in fact, it's not you, somebody near you. And as the Bible says that we should love our neighbors as ourselves, this is the way how to show some love by what we're going to be talking about today. So Rick, welcome. Glad to see you.
Thank you. Glad to be here.
Thank you so much. And Michael, I'm so glad that you're here today.
Thank you for having me, Greater Grace Church family. I'm honored and privileged to be here with you tonight.
Well, we're glad you're here with us. I want to ask you guys this question. Let's just talk about what is expanded Medicaid?
Well, I'll let Michael go first, and then
Okay.
I'll emphasize maybe some of the things he'll talk about.
Okay. Michael?
Certainly, and I don't know if you want me to start with a presentation. I can't
That'd
see
be great.
the room layout, so I want to be sure
That'd be great.
that I can get everyone the facts and we can display them. If that time is now past, I defer to you and you tell me what to do.
Well, let's go and have the presentation. That'd be great.
Okay, perfect. Give me a second. I'm going to share my screen here. Do you all see it over there?
Yes, sir.
Sure can.
Okay, perfect. So I'm going to just dive right in, and what we'll do is we can have some questions, and Rick and I can answer anything that anyone may have. But thank you for the lovely introduction, Pastor Jones. Really, Yes on 2 has been something in the works for quite some time. Missouri legislators have really failed to get any momentum on Medicaid expansion over the last 8+ years, and Missouri has spoken. And so because of Missouri and our will of Missourians throughout the state, throughout St. Louis, we really were able to make significant movement with getting this on the ballot. This was an initiative that was originally supposed to be on the November ballot, was moved up to the August 4th ballot in preparations because the state feels it is going to pass. And that is a response to the 300+ organizations throughout the state who have endorsed this, no matter their political beliefs, affiliations, across various socio-demographics, across various faith groups. Missourians have said, not only do we want this, when it was time to turn in signatures to the state, not only did we have enough, we had double the amount of signatures needed to get this on the ballot.
Excellent.
And so what is Medicaid expansion? What is Medicaid in its status quo? I really want to just lay out currently some of the misinformation that's out there about Medicaid, because people believe that in order to get Medicaid, you're just poor or you're a welfare recipient. And the reality is, in order to qualify for Medicaid, for someone who's a custodial parent or a family of of three with a single mom, two children, single dad, two children, or two-parent household with one child, you have to make less than $3,600 a month, or a year, I'm sorry. And that's about equal to $301 a month.
Yeah, hold on
I'll
one second,
repeat
Michael.
that. You have to make less than $3,600 annually to qualify for Medicaid. And so this will allow us to really extend access to care for those who are making $18,000 annually or less. And so we began to just start there. That's really our benchmark. We've seen throughout the state, but especially in St. Louis, a significant decrease in children enrollment. We've seen infant mortality rates amongst our Black women and the effect that has on our children and maternal health. We've also seen disparities that exist amongst our most vulnerable population, which are our seniors, blind and visually impaired, and our people living with disabilities. And so this will begin to address some of the inequities that we see, address some of the stringent requirements around access to care. We are plagued by so many disparities in our community. This isn't a one-stop shop that fixes all solutions. This just allows us to take a step in the right direction as it pertains to access to care and having our community members have access to quality care that is so desperately needed throughout communities like St. Louis and other parts of the state. And so we really began to talk about equity, dispel some of the myths about this is just a welfare program for Black communities throughout the state. That's the furthest from the truth. The demographics that make up approximately the 300,000 patients that will now be eligible for Medicaid, approximately 71% of those individuals are from our white communities throughout the state, while 18% are from our Black communities throughout the state, 6% from our Latinx communities, and our other racial ethnicities and demographics making up about the last 6% of that. And so again, really dispelling the myth that this is a handout for Black communities and Black people, because that's the furthest from the truth. However, we know that it will address a lot of the inequities that we see in healthcare that are designed, are explicitly within the design of healthcare, which we know as systemic racism. And so again, who's really benefiting from this? And we see about 71% of individuals who would now be eligible for Medicaid have at least one full-time job. And again, really dispelling that myth that this is a handout, because it's not. It's really ensuring that people that are working hard to provide for their families have access to care just like anyone else, and they don't have to choose with taking a big chunk of their checkout for employer-based insurance or a marketplace plan, but they can use that money to help their family, many of families who are fighting for survival, because we know that minimum wage is not a livable wage. And so really beginning to address those economic disparities that exist within a capitalistic healthcare system as well. In addition to that, it expands it to about 14% of those who have part-time jobs. These are our people that are working multiple jobs to make ends meet, really doing what they can for their families, especially during a time like this with COVID, a pandemic. These are our essential workers really doing everything that they can to ensure that their daily life is not disrupted by the pandemic. And so again, extending access for our community members who are living with this reality. And then lastly, it extends access to about 15% of non-workers. We know that that's our vets who are no longer working. These are our elderly demographics that's no longer working. And sometimes our disabled populations who do not qualify based on the requirements financially under the current Medicaid eligibility criteria. So again, really just wanted to dispel some of those myths and pointing out that this really helps our workforce and help us create some economic viability. And so what is that workforce? What does it look like? These are our essential workers working the front lines for us right now who are at highest risk for COVID contraction. And we know that our Black community specifically makes up about 60% of all frontline jobs, those essential jobs. So food prep and service related occupations, personal care and service occupations, our environmental crews, our maintenance crews really working hard to sanitize our churches, our office buildings, our hospitals, our nursing homes, our long-term care facilities, our rehabilitation facilities, our healthcare support occupations, including our occupational therapy assistants, our physical therapy assistants, our nursing aides, all of these occupations who are making approximately $28,000 or less, making less than $13 an hour, really extending access to care for them and so many who desperately need it, who have long awaited for the opportunity for equitable access to care without having to sacrifice money out of their check, which we know is a disruptor to the life and a lot of the quality of life that our community members are holding on to because of the cost of living, because of the inability to get minimum wage raised to a livable wage. And so I'll outline for the next half of this presentation really what's happening in the campaign. Some of us, or a lot of us rather, know the disparities and how they exist. But the key is, what can we do moving forward? What is the campaign doing to ensure that we can pass this? Although it's polling well in Missouri, we believe that that's not a lead. We're going to continue to fight as if we're behind because the reality is, in the front lines of community, we are behind. And so we can't afford to let up at any moment from now until August 4th into November and beyond. And so what we're expecting from the electorate in Missouri is about 3.9 million people are registered to vote. We want to ensure we get everyone out to vote. Those inactive voters throughout our community, make sure they understand the gravity of this moment and how this moves us towards another step towards equity. And the long fight, even before Ferguson, and the efforts we've seen really being led by so many community members, even after the closure of Homer G. Phillips, we want to make sure that we can continue that legacy and address those inequities with policies, but not only policies, but being able to move that needle forward. And so getting every single person out to vote, because Missouri asked for this to be on the ballot. So we want to ensure that Missourians are represented and that they feel protected during this pandemic to actually show up to the polls, not be marginalized, and feel safe practicing their constitutional right to vote. And so just real quick, we're going to go over the objectives, some of the messaging framework to dispel some of the myths about Medicaid expansion. I'm going to share with you some resources that Greater Grace Church has at their disposal. But then lastly, what are some of those key dates that are remaining as we get closer to August 4th? And so I won't read all of this. I'm pretty sure none of you can see this. But one thing I really do want to point out is this triangle infographic, which really shares 4 key messages about the campaign. And the first and utmost is vote yes on 2, vote yes on 2, vote yes on 2. I know a lot of people can't say that. I can. So I'm going to say it again, vote yes on 2, because of all the reasons I said. But in addition to that, we know the facts, and here are some of them. This brings home our tax dollars. We're already paying for this. We are paying for this through our federal tax dollars that we send to DC, and it doesn't come back to Missouri. We know for a fact that it goes to 36 other states who've expanded Medicaid. and Oklahoma just passed Medicaid a week ago, and it'll now go to 37 other states. And so this allows us to bring our tax dollars back to the state and have say over what we do with our tax dollars, which is start with expanding Medicaid. The next, it helps our economy. It protects those frontline workers in healthcare who have been working tirelessly to address the needs and the capacity of the healthcare system during this pandemic. And as I mentioned, about 60% of those are individuals from our African American, Indigenous, and people of color communities. And so we want to ensure that we maintain that workforce, but not only that, bring jobs back to Missouri that are essential to healthcare capacity. So we know this will create about 16,000 jobs annually, about 40% of which will come to St. Louis and the Kansas City areas respectively. And then the other 60% will go to our rural communities. We must not forget that our rural communities are sometimes synonymous with poor whites. However, we have Black community members in rural communities throughout the state, sometimes the most marginalized community members. So we want to be sure that we can speak up for them as well. Not only are those jobs coming to Missouri, they're quality jobs, jobs paying $15 an hour or more. And that has a subsequent overall impact on Missouri. This helps keep some of those rural hospitals that are vulnerable, which are about 26, are vulnerable to closing. Since 2014, there has been 10 hospitals to close because of the lack of funding, the lack of financial constraint. And so we want to be able to save healthcare not only for our rural communities, but expand that access to our suburban and urban communities as well. We know the impact it would expand access to those who are making $18,000 or less, but also it allows for us to have the necessary care we need to disrupt some of the disparities we see that exist. Take the preventative care for cancer treatments or cancer screenings rather, the infant maternal health that I mentioned, making sure that our kids have access to adequate quality pediatricians, making sure that we can address some of the rooted systemic racism in the response to the opiate crisis. We're still seeing Black men die at a higher rate than anyone else throughout the state. While the state is decreasing, the overdose deaths for Black men are increasing. And so this allows us to be able to disrupt or begin to disrupt rather those systemic racist issues that exist in healthcare delivery, access to care inequities, et cetera. And as I mentioned, it helps the economy, it brings home those tax dollars, and that's why we're saying yes on two. And we have seen one of the most diverse coalitions throughout the state, representative of 300 plus organizations, as I mentioned, the St. Louis American being one of those, and really just wanting to point out that first line, voting yes on Amendment 2 for Medicaid expansion in Missouri may be the single most important reason to go to the polls on August 4th. No disrespect to any of our candidates running for office. We want to make sure we get out and vote and speak our mind for who we want in office. But this issue, regardless of who's in office, will persist if we do not get out to vote and speak our minds about the injustices that exist in healthcare, which is representative of a larger systemic issue that we have been fighting for in the streets day and night. And so we want to continue that fight. We want to make sure we show up to the polls and do what we know is needed to do to ensure we address some of the inequities that we see and live every day of our lives. And so what are some of the resources at everyone's disposal? We have a communications toolkit where Greater Grace Church can go in, copy paste information to share to church members and their broader social a platform. We have a social media toolkit where we have images, infographics, where you can literally populate, copy and paste the message there. There's there's communications geared solely towards African American and communities of color specifically, making sure that we know the key facts around the issue and that we're not misinformed by conspiracies and myths. The church is such a valuable partner in this. We know that there's so many thoughts about pro-life, pro-choice, but the diverse group of faith leaders that are represented in our coalition really have said enough is enough. This is our responsibility to further serving all God's children, to make sure that we are addressing the disparities that exist and doing everything within our power to make sure that we see justice on all and every way possible. And healthcare for Missouri, Medicaid expansion, yes, on 2 does that. In addition to that, there are opportunities to do virtual phone banking where Greater Grace Church can hold a virtual meeting like this where we can call our fellow Missourians to say, hey, this is why we think this is important. We will train you. We will help you with all the scripts. We will help you with text bank where you can text people. We know that relational organizing is the most impactful. When it comes straight from your mouth to your family members, they'll believe that before they believe me. And so we want to make sure that we are sharing facts, but we can do some relational organizing to disrupt some of those myths that we'll see come up as we get closer to August 4th. And so we encourage folks to sign up for phone banking and text banking. The link is there. I will share that with Greater Grace Church after this. I'll shoot an email over to you. There's also yard signs. Those are a hot commodity right now. It seems like every time we set them down at locations, they're gone within the hours. So we want to make sure we can get yard signs. The Urban League Jennings location has been our site in North County, but if I need to personally deliver some yard signs to Greater Grace, I want to make sure we do that. In addition to that, there'll be a grab and go yard sign location here in St. Louis. I'll get you more information about that. But then we'll need poll watchers the day of the election. We know that on August 4th in Missouri, we're dealing with humidity, we're dealing with heat, and we know that in many cases, our voting turnouts are sometimes disrupted. So there's long wait times, there's people waiting in the sun. We want to make sure not only we can keep people hydrated, keep them motivated to stay in those lines, but we do it in a safe manner. We're properly social distancing. We will have masks. Prepare St. Louis has been a great partner in ensuring that we can spread awareness, make sure we get PPE out. Christian Northeast and BJC has been a fantastic partner in that as well. And we want to continue that not only in a response to COVID, but we want to ensure we're practicing safe guidelines on the day of the election as well. And so some of those key dates, Wednesday, July 22nd is the last day to request a absentee ballot. Absentee ballots are ballots where you don't need it notarized. Only our 65 and over demographic are allowed to get mail-in ballots without notary. So we're informing all people to vote absentee if you're high risk or if you're a caregiver for someone who's high risk. And so go to the Secretary of State's website, get that application filled out. But even then, if you do not get or have the opportunity to ensure you get your ballot or your absentee ballot back to Jeff City in time, you can take that ballot to your local voting precinct that is for you to vote, hand it in, and actually vote in person. And so what I'll do is Denise Lieberman of the Missouri Voter Protection Coalition did a fantastic presentation for us. I'll share that with Greater Grace Church so you have all the facts She lays it out fantastically, does a much better job than I can do. She's the one that's fighting with the ACLU and the county NAACP with the lawsuit against Missouri. And so I want to get you those facts straight from her mouth. And so you'll get that in presentation form as well. Our Get Out to Vote strategy is going to be in full force July 25th, where we're going to have phone banking all day, text banking all day, making sure that our radio ads, TV ads are at optimal volume, that we're getting it out across all platforms to lead us to August 4th, where we want to say yes on two, yes on two, yes on two, because we know the gravity of this moment. And as the mayor can mention, this is the single most important reason to get out to vote August 4th. And so thank you again. I'm going to stay around with Mr. Rick Stevens to answer any questions. My contact information is here. Greater Grace has my contact information. Be sure to ask me any questions. If there's demographic specific questions about impact of families, impact of schools, impact of a specific population, we want to get you that information. That's why our diverse coalition has been so fantastic. And again, I want to reiterate that this isn't the Yes on Two campaign. This is Missouri's campaign. Missourians have spoken. This is the power and the will of the people. So we want to ensure that we can get everybody out to vote August 4th in a safe manner so that we can get Yes on Two passed because this is a pivotal moment for our community.
Wow.
Michael, I want to say thank you. That was a powerful presentation.
That was a lot.
Lot.
And if you look at what was presented, I mean, you talk about a full meal deal that Michael just gave us. And I'll go back to one of the things that Michael emphasized on, and I want to point out again. Missouri has the lowest qualifications to qualify for Medicaid if you're a childless adult. And as Michael emphasized, and we've emphasized before, $3,600 a year, not a month, not every 2 or 3, but $3,600 a year. So as Michael said, what was that, $310 a month? Something right around there, $311 a month. That probably equates to probably, $4 or $5 an hour, probably less than that. But the point is, and if you wonder why Missouri is behind on a lot of things, and Michael talked about equity, and not only in the urban areas, but also in the rural areas as well. So if you're a childless adult and you make $10,000 a year, you make $8 an hour, you make $10 an hour, you're not, unless your employer offers you insurance, you don't have it. And one of the things Michael had on one of his slides is you're making decisions between putting food on the table or if I get health care. And, those issues like that continue to, as Michael says, you have the systemic racism, you continue to perpetuate the issues of health care, you continue to perpetuate, not getting your diabetes checked. And if you don't, so for diabetes, North County, the highest prevalence of diabetes is in North County. You continue to let that go. It leads to kidney disease. It leads to congestive heart failure. It leads to so many other complications. It costs the system more to take care of you after you've gone through all of this. And so why don't we give people access to care? Therefore, we can stop some of these issues from continuing to go on. We need to pull this lever, giving access to care, and then once we give them the access to care, we need to go tell them where they can go get the care at now as well. The other thing Michael had on his presentation as well, if you noticed on one of his slides, he talked about the workers that would need, that this would benefit. Food service workers, housekeepers, he talked about people that do the cleaning. And in this pandemic that we're in, these are essential workers. And these are workers who have to show up every day. Many of them are our relatives, cousins, neighbors, and friends. And so we definitely need them in this trying times like this. We need them to have access to care. We need them to be well. We need them to do jobs so we can do our job.
Right.
And it's a ripple effect from there. So it was a lot that Michael had in his presentation, very powerful presentation as well. And like you said, it was a lot there. So
There's a lot of great information, and that's why everybody needs to really focus on going to vote on August the 4th to make a difference in this state. From what I understand, it's almost, 500,000 Missourians that are not insured. Is that number correct or incorrect?
Yes. So Families USA released a report actually yesterday, and I won't be able to quote the report verbatim. There's been so many things I've had to do. I haven't even had a chance to read it quite yet. But Missouri has the highest uninsured rate after based on the impact of COVID. And so this is alarming. This disrupts a lot of comfort for a lot of Missourians. And so we see the true value in this immediately. I can't express enough, this will not increase your taxes. This is already being paid for.
Yeah.
We're just not reaping the benefits. In addition to that, this has been demonstrated through Washington University studies, various other studies, that this is actually cost neutral and that there's opportunities for cost savings many of the times. And this is cost neutral before we even talk about the economic impact for job growth and then job security and ensuring those frontline healthcare workers' jobs. And so this is going to have ripple effects. Even if you don't qualify for this, or you may think like, hey, I make too much money, I'm not going to be affected by this, and so it's going to be safer for me to vote no. That's actually far from the truth. This is going to have ripple effects across our state budget. We see the governor already cutting to education, cutting to public safety, cutting to essential components of the budget that we know Black communities are most affected by first. And so we just want to point that out because there's a lot of misinformation out there. If you take Arkansas and Michigan, for example, over the last 3 years, they've been able to save over $500 million in cost savings from their Medicaid expansion program. And so we don't want to let partisan politics divide this. And that's why we have such a diverse coalition of endorsing organizations. And we want to highlight that because, again, this has been the people throughout various communities throughout Missouri really speaking up and saying we need this and need it now.
36 states have implemented Medicaid expansion. As Michael said, Missouri, Oklahoma, a couple weeks ago, just passed it as well. But the states that have, so it's 37 states, but 36 states for the past history, all those 36 states, nobody has repealed it. It stayed in place. And it takes an act of Congress to overturn it. And so, you know, as Michael was alluding to, you know, people are talking about the cost. We got to stay away from the fear. And people are going to say, oh, will the federal government continue to pay for it? Well, it takes an act of Congress to overturn this. So right now, I don't see where any states, any senators would overturn it.
Right.
If you remember during the campaign after the current president won, we're talking about repealing Obamacare. When individuals found out, well, Obamacare is the Affordable Care Act, and that's by insurance. Well, I like that. I don't like Obamacare, but I like the Affordable Care Act. And so we got to stay away from the spin. Both were the same. Right. But, you know, it's that fear that keeps us away from voting for our interest. And especially in the rural areas of Missouri, this will benefit, as Michael said in his presentation, it's not only benefits African Americans, it also benefits Caucasians as well. So rural areas benefit. And the rural areas have just as many issues as we have in the urban areas. And so why not just bring up the whole state? Everybody gets a piece of the pie. Those who have already had the pie can continue to have their piece of the pie. We're just wanting others to have that piece of the pie. And it just brings up the whole state and just makes us better. And we don't have to have where so many Missourians don't have insurance, as you all just talked about.
Right. Now, and the one thing about the expanded Medicaid, it's going to bring $1 billion back to the state. Tax revenue we're already paying out. So that's a no-brainer. For those that are in the rural areas of the state, time is a major factor. If you're having a stroke, heart attack, there are hospitals that have been closed in this state, in the rural areas. So therefore, the longer the time you have, the worse your situation would be. So that's going to save lives. You're also going to impact the economy of the state, so in a positive way. So we found another win-win situation. We're shortening time for care. We're ensuring that our medical professionals are in place so that we could be able to get care. You're also allowing for us to have access to care, to have preventive, so we don't have to wait until we're in a traumatic situation, so we can preserve our lives with better quality of life. So it's really should be very simple for everybody, the fact that if you want to do something good in this state, good for your fellow Missourians, good for yourself, for your family, your aunts, your cousin, you want to vote for Medicaid. Yes on what? 2.
Yes on 2.
Okay. So let me just ask you a question, make sure people are clear. What are the qualifiers when expanded Medicaid is passed? What must I do to qualify?
Well, I think it's much like and Michael, you can correct me if I'm wrong, it's much like the current process. You have to make less than, I believe it's going to be $28,000 a year. I think that's our number, correct, Mike? Yeah, and so you have to be making less than that. And you can be a childless adult or to qualify, as opposed to now where it's less than $3,600 a year, right, and a childless adult. And then you would go through the steps of filling out the application forms to qualify going forward. I may have missed a step there, Mike, but I was kind of jumped to go on this.
That's fine. So what you're saying that really we're going from $3,600 a year to less than $28,000.
Mm-hmm.
From what I read, if I have it correctly, you can have like up to $2,000 cash or so forth, and your residence is not going to be touched, as with Medicaid. Is that correct?
Yes, so there's a couple things there. I didn't hear everything. I'm sorry. Sounds a little bit low for me, but it's okay. So what it'll do for families, for a family of 3, if you make up to $30,000, you now qualify for Medicaid. If you are a worker, a non-custodial parent between the ages of 18 and 64, making approximately $18,000 a year, you now can qualify for Medicaid. And it has impact on our disabled population, our seniors, and the assets which you're mentioning, Pastor Jones. I don't know the exact figure, but in the status quo, as a senior who has who's single or widowed or widower, you have to have less than $1,000 in assets, excluding your house, of course, to qualify for Medicaid. If you are married, you have to have less than $2,000 in access, and so that has some implications on being able to have dual enrollment with Medicare and Medicaid as a secondary insurance. The spend downs gap is affected there. I can get you all of that information. I don't want to confuse anybody because I am not an expert on those particulars. And so I can get that information over if there's more questions about that specifically.
The one thing for us to know, to remind everybody, you're opening up access to over 300 to 500,000 people. You're allowing them to get services that can address pre-existing conditions. You're gonna bring $1 billion back to our state. You're gonna help the economy. And I just reiterate that over and over again, the fact that it is a positive move. It doesn't raise our taxes. We're already are paying taxes. So all we need now is bring the money back home.
Yeah, no, absolutely. And as Michael alluded to, Arkansas, Michigan, other states have done studies and have shown where it's been a positive impact. It's spurred the economy. It's brought in more jobs. But then also, it's also not been a burden to the state as well.
Right.
And so those states who jumped in early got 100% paid by the federal government. Now the federal government pays 90%. But even as it pays 90%, you're still going to look at seeing where you're going to see those savings of people getting in for their health care. It's going to increase the economy. It's going to bring the revenue back in. So you have more people working. Those people pay taxes as well.
Very good, very good. I want to ask you this question, 'cause you already have addressed it, but I just want to bring it up again, Dan. And I'm going to do it specifically now in the St. Louis bi-state region. And as the president of Christian Hospital Northeast, you know, you have all these patients who are coming in and coming out. Expanded Medicaid, it will help you to be able to service the community better, because people can have better access to healthcare service.
Well, people always still have access now. It's
Okay.
the emergency room. But that's not the best place to get your access.
Okay.
We'd like for people to go to their primary care doctor because we want to keep emergencies for emergencies.
Okay.
True emergencies. Crowding up the emergency room, that's exactly what it is. It's for people having true emergencies. And during COVID-19 and even before that, we've seen people have true emergencies. But for just a cold and a cough and some of the things that are not true emergencies, we'd like to give you access to a primary care physician, a family medicine doc, an internist, maybe a nurse practitioner. You can go to one of the convenient cares, urgent cares. Go to one of those places as well and kind of just keep those true emergencies for true emergency. Christian Hospital has the busiest emergency room in the state of Missouri. You know, we've always said that because there's a need. And we also know that a lot of people do not have access to care, so they use the emergency room as a primary care physician. Now, what this will do, this is one lever, give people access to care. Now, the other lever will be, how do we get people to use use the doctors that are out there as well? And so that's what we want to do, and there'll be a whole lot of education on that going forward.
And if I could add to that, I don't want to forget the mental health and behavioral health component in all of this. We know that the largest mental health provider in the state now is the prison system. And who does that affect most? We know it from the crack epidemic. We see it now with the opiate epidemic. It's affecting our communities the most because of the predatory practices of policing. And this allows for those who are coming home from prison quicker access to care. We know that they are at highest risk for adverse health outcomes. Overdose is at highest risk for those recently returning from prison. We know that it'll allow for those battling with the recovery journey to now couple that behavioral health treatment intervention with preventative care, because we know those battling with addiction also have chronic health needs outside of their addiction as well. And so this ensures that we can provide a higher quality of care delivery for so many who are, as Rick mentioned, defaulting to our emergency departments, who are being criminalized still to this day for addiction and drug use and mental health needs. And so we want to, again, start to disrupt that. There's so many layers to this that's not going to be answered overnight. But what we do know is having access to care allows for us to take a step in that direction towards social justice. I'm a firm believer that the healthcare, the fight for healthcare in our communities is the ground zero for civil rights in our country right now. And we are seeing it every day in every facet, no matter if you're a black mom, a black baby, a black man, a member of the LGBTQI community, you are affected adversely in our health system, and that's at disproportionate numbers. And so again, this really moves us in a step towards addressing those issues.
Great. You know, it sounds so simple. I want to ask this question. Why has there been a fight in our state for so long to accept this?
Politics.
Okay.
You look at the politics of it. And even though there have been other red states that have passed it, like Arkansas, and that have had the benefits, and there are other red states that have passed it, I would just have to say politics. I was not here in Missouri when it first came up. I know there was a run before and got pushed down. And you had a Democratic governor, but you had a Republican-led, Congress and the representatives and senators. And so it's politics. Okay. And, the politics have put, as we've stated before, the fear out here, Michael says, going to, people put out there what it's going to do. And what we want to do is tell you what it is doing and what it has done based on the facts and based on the data. And so a lot of times where it can really help, people have voted against their interest in this state as well. Michael might have a better perspective than myself, but I just have to say politics has been the main reason.
I think that's a great summary, Rick. I don't have any more to add about the politics side, but we know that with everything that's implemented from policies and strategies, there's a group that benefits and a group who's harmed. And what we do know with this, that everything that the evidence shows us that this does no harm for our state. Looking at red states and what they have demonstrated with Medicaid expansion, it does no harm. Currently, if a woman wants a mammogram under Medicaid, the state covers it at 35%. With expanding Medicaid, the state now is responsible for 10% of that. As I mentioned, it has ripple effects on our budget. It stimulates our state economy, which is so desperately needed. It allows for us to disrupt some of the injustices that we see from the disenrollment of children throughout the state, but especially in St. Louis. And so to the point, yes, there will be opposition that try to make this partisan. And that's why we want to, again, reiterate how Missouri has really came up, showed out, made sure not only we got this on the ballot, but we exceeded the signatures. So there's no mistake that Missourians wanted this on the ballot. But now we have to act. We have to get out, vote, and make sure this passes, because now the next step is to ensure it gets implemented, ensure we overhaul the state systems that allow for the status quo to persist, and really address some of those issues that we see the state legislators haven't moved on. And so this allows for Missourians to own that process a little bit more. And we have spoken, and now let's speak again and really confirm that we want access to care for all of Missourians, whether it be our urban and suburban areas, all the way to our rural communities that have so desperately needed access to care and jobs as well.
Thank you. So
No, nothing more to add.
okay. So, and the reason I asked that question is because sometimes somebody may talk to somebody and say, well, it's going to raise our taxes. We know it's not going to raise our taxes. And I think it's so important that everybody, that you will really take the time out and to think about that on August the 4th, we all need to go and vote. We all need to make our way to the ballot box and cast our vote, because this will aid so many people who are not getting the coverage that they desire, that they may have better health. So you want to go, and not only just go, you want to now start to calling your friends, calling your family, make it an effort that we all go to and vote at the polls to make a difference so we may have a better health care in the state of Missouri. Now, I emphasize too, if somebody thinks that this is just for minorities, 71% of the people that benefit are Caucasian. And so this is not about just a minority issue. This is about a human right issue, that everybody deserves health care. And therefore, you want to do what? Go and vote. Is there something you want to say?
No, you're spot on, and I think Michael also talked about if you absentee vote, that you have to have
Right.
it notarized unless you're over 65. I believe that's correct. And then also the day of to go vote as well. And also, let's remember too, 36 states have implemented Medicaid expansion. Mm-hmm. Nobody has repealed it. Nobody has turned it. Nobody has gone back, because regardless of whether the state is red or blue, it's a good thing.
Mm-hmm. And with it, as you stated, just to emphasize again, some of the states are beginning to find savings. So therefore becoming profitable to them in a good way.
Yeah, it's not a burden to them, and so they're seeing the economic benefit. More people work, more people pay taxes. It's an economic benefit for them going forward.
And to add to that, I'll clarify that, Rick, for you, because I know it's confusing. It's confusing for me, and I'm learning more about it to this day. And so we're recommending that you don't request a mail-in ballot. The mail-in ballot, once you request that, you have to stick to that process. And if you are not over the age of 65, you have to get that notarized. And so we recommend that you do not embark down that avenue. However, the absentee mail-in process is a little bit different. You are not required to have a notary regardless of age, as long as you qualify within certain requirements, and one of which is what majority of people in our community will fall into, is a high-risk demographic based on a criteria of chronic illnesses, which is asthma being one of those. In addition to that, you are a primary caregiver for someone who is at high risk. And we know many of our community members can't afford to pay for long-term care facilities, and grandmothers, grandfathers, uncles, aunts are staying with us. I know my grandmother stays with us. She actually just had heart surgery this morning. And so this is, again, impacting me directly and my family. And so these are the types of things we want to make sure that we clarify. In addition to that, if you fear you won't get that absentee ballot in time, you can show up on the day of the election and turn that absentee ballot in and still vote in person. Once that mail-in process is requested, you can't turn back. And so we want to clarify that if you're able and fall into those criteria of absentee voting, then do so. Do not request a mail-in ballot if you're under the age of 65, because once you do that, you cannot turn back. And we don't want anyone's vote to be missed. We want to make sure everyone follows those directions, make sure it's signed, make sure you go through all the necessary requirements there. I'll provide additional information from the Missouri Voter Protection Coalition that really helps clarify the nuances through all the process for Greater Grace Church. So you'll have all of that in a follow-up email.
Thank you for clarifying that between mail-in and absentee. I
Right.
appreciate that.
Oh, no problem at all.
Okay, so what we want to do is I want to encourage you again to vote if you need to. I have a question, Michael. What
Yes.
is the latest can they obtain an absentee ballot? Are you aware of the date?
Yes, so the last day to request that is July 22nd. That's a week from today. And so if you fear you are at high risk or you are a caregiver, you want to request that today. The sooner the better. And we don't want to wait till the last day to try to turn that in because that vote won't be counted. And so if you are fitting within that demographic of high risk with those criteria that will be listed on the Secretary of State's website, go ahead and request that. If you're a caregiver and fall into that category, you can go ahead and request that. You could do that now. And so instead of waiting, Google Missouri Secretary of State office, and the voting process will be there where you can go and get that application. Missouri Voter Protection Coalition, I forget the number you can text to get information directly to your phone. Please forgive me, but I'll share that information and you can text and learn more about that process, and they'll keep you up to date about those key dates as well. And so that's one thing we want to be sure to clarify because it's confusing. It's confusing for me. It's really a reflection of even the Medicaid process. If Medicaid is, as Rick mentioned, Missouri is one of the most stringent states on that. And not only that, it's hard to really understand the application within itself. And so we want to begin to unfold some of the just nuance and ambiguity in a lot of these processes to help people understand and simplify some of this because it's doctors, it's people with PhDs that don't even understand this. And so we want to make sure we can simplify it as best as possible.
Okay, so I'm just going to reiterate, so they should go to the Secretary of State website to get the information for the absentee ballot.
Yes, the application is on the Secretary of State's website.
Very good, thank you, thank you. Everybody, this is an excellent opportunity for us to improve our state, to move it forward, and to make sure there's equitable health care for the citizens of this great state of Missouri. It's an opportunity we don't want to miss. 37 other states have already done so. And we're paying taxes for $1 billion by voting yes to bring $1 billion back to Missouri so that the citizens that are not being covered can start having health care, a better quality care, and a better quality of life. This is up to us. No longer is time to talk, it's time to act. So if you need your absentee ballot, when we finish this program, go to the state of Missouri, Secretary of State of Missouri, and get the information. But make sure you vote. And between now until August 4th, text, call, remind your friends, get a sign, put it in your yard, let everybody know, vote yes on 2. So Rick, I want to thank you for this evening. Michael, I thank you so much for this evening. And everybody who tuned in, I thank you for this evening. And I'd like to remind you, we have open at Greater Grace Church for our 8 a.m. and 10:30. If you come, we do have social distance for seating. We do take your temperature, and we do ask you to wear a mask because we want to worship and all be healthy. So God bless you. Love you to life. See you next time. Bye.